Hello, and thanks for joining us for the Pharmacy Cannabis Lecture Series. My name is Candace Hawes, and I want to thank all of our viewers and customers from the Pottery, from the Pharmacy Santa Ana, Santa Barbara, and Berkeley for joining us today. Today, we have a great webinar with you with a very special speaker, Dr. Tim Hsu, who was actually one of my very first webinar guests, so it's really nice to have him back on. And he's a subject matter expert to discuss the endocannabinoid system of animals. I think this topic is really interesting because a lot of people don't know that all vertebrate animals, that's mammals, birds, reptiles, fish, all have an endocannabinoid system. And many invertebrate animals like sea urchins, leeches, mussels, nematodes, and others like that, they do as well. And even invertebrate species as primitive as the Hydra have also been known to have an endocannabinoid system. And this is important because research suggests that a balanced endocannabinoid system promotes sleep, mood regulation, stability, gait, pain perception, memory, body temperature, immunity, reproduction, and so many things more. And we'll talk about those today. Researchers also believe that understanding the endocannabinoid system of these different species can also help us understand its role in the development of clinical applications. So because of all those really exciting reasons and potential, I'm really excited to have Dr. Hsu with us today to talk about the endocannabinoid system of animals. Dr. Hsu is a licensed veterinarian and subject matter expert who has dedicated his life to the education, research, and advocacy of cannabinoid therapeutics. Dr. Hsu has been featured on the Today Show, NBC News, CNBC, NPR, and more. Currently, he's leading a campaign to legalize cannabis for pets and protect the rights of veterinarians to discuss cannabis as a treatment option with their pet parents. You can find out more about this by staying on the webinar today, and we'll talk about it. Or you can also visit the website, petcannabis.org. So thank you so much for joining us today, Dr. Hsu.
Thanks for having me, Candace. Really appreciate it.
Yeah, I am so excited to have you back on. And like I said, there's so much potential to understanding the endocannabinoid system of animals. And so thank you so much for being with us today.
Absolutely. And it's great to see that you've got an audience from around the world. So that's very impressive.
Yeah, we have a great group. And I'm really excited to add this to our catalog and our library of information.
Well, great. Well, let's get rolling with this. This is a topic that is very important to me as a veterinarian. And so I want to be able to present this information to you, the audience, from the most scientific and medically accurate viewpoint. So with that, let's get rolling and let's start talking about the endocannabinoid system of animals. In addition, we'll talk about cannabinoid therapeutics, what research has been done out there, what the evidence currently says, because we can't really talk about the endocannabinoid system without talking about cannabinoids in some form or fashion. So the endocannabinoid system is a remarkable body system because it's different than, say, your circulatory system, your nervous system, your digestive tract, because it's something that was discovered relatively recently. It was discovered in the late 80s and the early 90s. And the reason why it was discovered was because researchers wanted to figure out why THC caused a high in people. And what they found was that THC binds to this specific receptor in the body, which they called the CB1 receptor. And then after they discovered the CB1 receptor, they started looking for other potential receptors in the body. And that's how they found the CB2 receptor as well. So this is different than all the other systems because the other systems we've known about for a very long time, and there's been a huge body of research that's been contributed to those other systems, say the nervous system or the circulatory system. But the endocannabinoid system is something that has been around for a very long time. Just because it was discovered about 30 years ago doesn't mean that that's when it started. In fact, because so many different animals have endocannabinoid systems, we know that this system from an evolutionary perspective has been around for millions and millions of years. And so what's remarkable is that this system that has been around for millions of years, we're just learning about it right now. And we're learning about the impact that it has on health and disease. So this system can be thought of in three components. We have the cannabinoid receptors, as I mentioned, CB1 and CB2. These are receptors that are located throughout the body, and these are what cannabinoids will bind to. And then the second component of the endocannabinoid system are what we call the endocannabinoids. And these are, in fact, cannabinoids that our own bodies produce. So endo meaning body. So these are the body cannabinoids that we produce. And in fact, we need to produce these cannabinoids in order to maintain our health. The third component of the endocannabinoid system are the enzymes that make and break down these endocannabinoids and move them around the body. So the function of the endocannabinoid system is what we call homeostasis. And so the easiest way to explain this is it provides balance. It prevents there from being too little or too much of something. When we think about kind of like the Goldilocks situation, we don't want our soup to be too hot. We don't want it to be too cold. We want it to be just right. And so this applies to a lot of different functions within the body. What's remarkable is that the endocannabinoid system has been shown to have some sort of role or some sort of interaction with functions like appetite, metabolism, sleep, pain, mood, memory, and inflammation. Now, this isn't to say that this is a complete list, because this is actually only a partial list of what the endocannabinoid system has been shown to have some degree of influence over. But the degree of influence that it has over these functions is to help maintain that balance of preventing there from being too little or too much of something. So for example, with the appetite, you don't want too much appetite and you don't want too little appetite. You want just the right amount. And so other things like pain sensation or inflammation, the endocannabinoid system has also been found to have a role in helping to regulate. Now, what's remarkable about the endocannabinoid system, as Candace has mentioned, is that it's present in all vertebrate animals and, in fact, also in some invertebrate animals as well. So when we say that it's present in all vertebrate animals, we're talking about mammals, birds, fish, reptiles, and amphibians. What's really interesting is that, primarily when people talk about cannabinoid therapeutics, the current body of research that's out there has primarily focused on only a handful of species. For example, dogs and cats. And then there's been a little bit of research that's started to look into horses. But we know that all vertebrate animals have endocannabinoid system. And so there is the potential for all these different animals to benefit in some form or fashion from either cannabinoid therapeutics or a better understanding of the endocannabinoid system. So one of the interesting things that we're doing is we're partnering with a zoo in Colombia, and that zoo has already started using cannabinoid therapeutics for different species like hyenas, for an electric eel, and for a mountain lion as well. So they are actually using cannabinoid therapeutics for these different species that most people aren't familiar with. And then I also have some friends in Mexico who have been using CBD for an elephant for wound healing. So that's what's remarkable, is that it's present in all vertebrate animals. So all these animals deserve to have a better understanding of their endocannabinoid system. So it's not just restricted to humans, but all these different species have endocannabinoid systems. Now, as I mentioned before, there's two primary cannabinoid receptors, CB1 and CB2. They are found throughout the body. What's interesting is that when the CB1 receptor was first discovered, it was thought to be primarily located in the central nervous system, so the brain and the spinal cord. But as time has went on, researchers have been able to find the CB1 receptor all throughout the body. So it is found in places like the circulatory system. It is found in the digestive tract. It is found in the skin. And primarily the CB1 receptors, their role, at least in the brain, is to regulate neurotransmission. Now, the CB2 receptor, on the other hand, is found primarily in the immune system, where it has immunomodulatory functions, meaning that it prevents there from being too little or too much inflammation. But just like the CB1 receptor, it is also found throughout the body. And depending on the cells that they are found in, these CB1 or CB2 receptors can have different functions. Now, what's remarkable about this is that is also some thought that there may be additional cannabinoid receptors, because cannabinoids don't just bind to CB1 and CB2 receptors. They actually bind to a lot of other receptors throughout the body. So there is some thought that certain receptors that are out there may eventually be called the CB3 receptor, or maybe we'll eventually have a CB4 receptor. This is what's so exciting about this field, is that we're really just starting to dive into our understanding of the endocannabinoid system and the receptors, the endocannabinoids, and the enzymes that are involved. So when it comes to cannabinoids, we have to understand that there's three types of cannabinoids. Most people are familiar with the cannabinoids that are found in plants, and these are called phytocannabinoids. So primarily things like CBD and THC. But we do have two other categories of cannabinoids that are worth mentioning. So as I talked about, there are endocannabinoids, meaning the cannabinoids that our own bodies produce, and we have to produce these cannabinoids to maintain our health. The two major endocannabinoids are called anandamide and 2-AG. But what's interesting is that these endocannabinoids were found early on, but as time has progressed, it has been discovered that these are not the only endocannabinoids that our bodies produce. In fact, the current estimate is that our bodies produce about 7 different endocannabinoids, but the two most well-known are anandamide and 2-AG. Now, the second category of cannabinoids are phytocannabinoids. And as I mentioned before, THC and CBD are the most well-known and well-studied. But what's remarkable about this is that the cannabis plant doesn't just have 2 cannabinoids. In fact, there's been over 140 different cannabinoids that have been identified in the cannabis plant. This is not to say that every single cannabis plant has 140 of these cannabinoids. In fact, they, depending on the strain or the variation of the cannabis plant, they may only have a small component of those 140 different cannabinoids. So, for example, a strain of cannabis may only have 5 different cannabinoids or 3 different cannabinoids. But we are finding that certain strains can have certain unique cannabinoids. For example, there are certain strains out there that have a high concentration of a cannabinoid called THCV. And what's interesting is that there is very little study about these other cannabinoids besides CBD and THC, even though some of them are currently available on the market. So cannabinoids like CBC, CBG, and CBN are increasing in popularity, but the body of research around those cannabinoids is still very early stages. Now, the third category of cannabinoids are what we call synthetic cannabinoids. So these are cannabinoids that are essentially made in a lab or synthesized, and they are designed to interact with our body's cannabinoid receptors. In fact, some of these synthetic cannabinoids are actually FDA approved and have been available for prescription by doctors for a number of decades. What's also worth mentioning is that sometimes these synthetic cannabinoids are made and they are actually street drugs. So when people don't have access to legal cannabis, sometimes they will get synthetic cannabinoids. And that is where you may have seen some of the news articles about people being hospitalized because they use synthetic cannabinoids. The danger with some of these synthetic cannabinoids is that they bind very strongly, very tightly to the CB1 receptor, much more tightly than THC or other phytocannabinoids do. So those are the 3 categories of the different kinds of cannabinoids that are out there. So one of the most remarkable things about the endocannabinoid system is that it's not currently taught in most medical, veterinary, or nursing schools. And the way that I like to present this is think about it as if the endocrine system wasn't taught in medical, veterinary, or nursing school. So the endocrine system is the body system that creates and regulates your body's hormones. You have an endocrine system. Dogs, cats, horses, animals have endocrine systems. And this is kind of like saying if you went to your doctor and you said, what's important about the endocrine system? What's testosterone do? What's estrogen do? what does insulin do? What does the thyroid do? And you can imagine if your doctor said, I don't know anything about the endocrine system. I don't know what hormones do. I don't know what hormones are. This is actually the situation that we're in right now, is that if you went to your doctor and you said, what's this about the endocannabinoid system? How does the endocannabinoid system impact health and disease? What does it mean to have potentially abnormal levels of endocannabinoids? Or could you have cannabinoid receptors that are malformed or misshapen? More oftentimes than not, your doctor, your veterinarian, or your nurse will say that they didn't learn anything about the endocannabinoid system in school. I know this because I talk to doctors, nurses, and veterinarians, and I talk to a lot of recent graduates as well. And I always ask them, how much about the endocannabinoid system did you learn in school? And more oftentimes than not, the answer is zero. We are starting to see some of that change, but it's really not to the level where it needs to be. So what I always encourage people to do is, when you talk to medical professionals, ask them about the endocannabinoid system, because it's important that they see that their patients or their clients are inquisitive, are curious about the endocannabinoid system and its role in health and disease. Unfortunately, a lot of this stems from prohibition era mindsets. I think if the endocannabinoid system was called something different that didn't have the term cannabinoid in it, we would be in a completely different situation where medical and veterinary schools would be clamoring to learn more about it and to be teaching their students about it. But because it has the word canna in it, it triggers a lot of these prohibition era mindsets that have to do that are more or less afraid of anything that has to do with cannabis. But my hope and one of my goals is that within the next 5 to 10 years, we'll be able to look back and say, wasn't it such a crazy time that, we knew about the endocannabinoid system, but we weren't talking to our clients or our patients about the endocannabinoid system and its role in health and disease. So I want to talk a little bit about CBD, cannabidiol, because it is something that has, starting from a few years ago, it's really made its rounds in the press, and there's a lot of hype around it. And I do want to be able to present some information about it from a scientific and medical lens, so that you get the most accurate picture about it. What's remarkable about CBD is that it is non-intoxicating, meaning that it does not cause a high. Something that deserves to be clarified is the term psychoactive or non-psychoactive. In a lot of medical literature and a lot of research, we will see the term non-psychoactive being used to describe CBD. And what I want to clarify is that that's not actually accurate, because when we talk about something that's psychoactive, we talk about something that alters the state of mind. And if something reduces anxiety or something reduces stress, that by definition alters the state of mind. And so by that definition, CBD is psychoactive in the definition that it can decrease anxiety. Now, we do want to say that CBD is non-intoxicating, meaning that it doesn't cause a high. And this can help us differentiate from THC, which can be intoxicating or which can cause a high, depending on the amount that's being utilized. Now, the research has shown that CBD does have a wide safety spectrum. So this is important because a lot of times the medications that we're using can have what's called narrow windows of therapeutic use, meaning that if you don't use enough, you don't get the therapeutic benefits. And then if you use too much, you can have toxicity in some of these prescription drugs that we're commonly accustomed to. This is in contrast to CBD, which actually has a wide safety spectrum. So what the research has shown is that in low amounts or high amounts, it does show to be very safe across different species, in fact. Now, what's interesting is that the research has shown that CBD has a variable effective dose. What that means is that it's not a one-size-fits-all situation. There are some interesting studies that have been conducted out there that do show that some patients actually are able to use a small amount and some patients actually have to use a much higher amount. What's good about this, though, is that there is a wide safety spectrum. So based off of the individual's needs, there is that assurance that there is that level of safety with it. So what does the research actually show CBD can potentially benefit? Because this is something that I like to clarify for, especially for professionals, medical professionals, because over the past 4 or 5 years, we've seen a lot of marketing out there that says that CBD can be used for this or it can be used for that. And so when we actually look at the research and we actually look at the science that's been produced, whether it's preclinical studies that have been done in lab animals like mice and rats, or it's actually clinical studies that have been done in dogs, cats, or humans, we do see that CBD has been shown to have a number of different benefits according to the research that's been done out there. Some of them include anti-anxiety benefits, anti-convulsant benefits. In fact, that there is actually an FDA-approved version of CBD that can be prescribed for certain forms of epilepsy. The research also shows that CBD can potentially have anti-inflammatory properties. It can be used as potentially an analgesic, meaning pain-relieving properties. And then CBD has also been shown to have antiemetic properties, or properties that counter nausea. Now, this is to clarify. This is not to say that these are the only things that CBD can potentially have benefit for, but these are the things that there are the most evidence for. There's the most research surrounding, and there's also the most feedback from clinicians that are seeing benefits in their patients that are using CBD. So I do want to talk about THC because THC does tend to have almost a bad reputation, and it does come from a lot of misinformation about THC. We do want to recognize that THC does have medical benefits. As shown by the research, THC has a number of potential uses in patients. That includes appetite stimulation. It has potential anti-inflammatory properties, potential pain-relieving properties as an analgesic, and then also it could be potentially used as an antiemetic to help control nausea as well. Now, the important thing to understand about THC is that the intoxicating effects of THC, or the effects that are the best way to, or getting high from THC, is dose dependent. And so what this means is that small amounts of THC actually don't cause a high. It's only when you reach a certain level, depending on the individual, that you can actually feel the intoxicating effects of THC. And so what that means is that you can potentially utilize THC in the appropriate amounts to have things like appetite stimulation without actually causing a high in the patient. So whenever I talk to doctors, they ask what are the benefits of cannabis, the way that I always present it to them is based off of the body of evidence that's been produced, based off of the research, based off of the clinical trials, based off of the feedback of doctors and veterinarians. The easiest way to remember this is the PAINS acronym. So when I say PAINS, the acronym stands for pain, anxiety, inflammation, nausea and appetite loss, and seizures. And so some of the most common uses of pain include things like arthritis for chronic pain. And there are actually several clinical studies that do back that up. A lot of veterinarians actually report successful use of cannabis, including CBD, for things like anxiety, whether it's separation anxiety or noise anxiety. As I mentioned before, cannabinoids like CBD and THC have anti-inflammatory properties. So there are veterinarians out there that have reported the use of cannabis to control conditions that have excessive inflammation, for example, skin allergies. Nausea and appetite loss are pretty well known uses of cannabis. And what's interesting, though, is that when it comes to appetite loss and it comes to appetite stimulation, that is actually in THC's domain. CBD doesn't actually cause appetite stimulation, but when you control for nausea, you can actually restore appetite. But in cases where clinicians are looking specifically to stimulate appetite in a patient, that is in the domain of THC. Now, as mentioned before, and it's been all over the news for several years now, cannabinoids, in particular CBD, are useful for treating seizures. And this has also been shown as one of the prescription drugs out there that actually has FDA approval, that it can be used for treating specific forms of seizures. And the feedback from a lot of clinicians is that they have also seen successful use in other forms of CBD and cannabis in treating their patients for seizures by decreasing the intensity or the frequency of those seizures. So one of the biggest questions that everybody has is whether cannabis can be utilized for cancer. This is something that's very interesting because there are a lot of preclinical studies out there that have shown benefits. And so when I say preclinical studies, I mean studies that have been looking at mice, rats, or test tubes or petri dishes, and then having cells in those test tubes or petri dishes, and then applying cannabinoids in that environment. So even though preclinical studies can show benefits, can show positive effects, this doesn't always translate to real world environments. There's been a lot of situations where preclinical studies have shown benefits for certain diseases or for certain drugs, and then whenever they carry over the clinical trials to actual patient groups, whether they're dogs, cats, or humans, they see that the environment has changed, or the medication or the drug doesn't respond the same in that patient group as it did in preclinical study environment. Now, what has the research thus far shown in these preclinical studies when utilizing cannabinoids and applying them to cancer cells? So far, it's been interesting because the research has shown that there is potential inhibition of tumor cell growth. There is evidence that cannabinoids can cause tumor cells to die off. There is evidence that cannabinoids can interfere with the blood flow to tumor cells, and then also prevent tumor cells from metastasizing or spreading to other parts of the body. In talking to clinicians, I have spoken to clinicians that have seen some very interesting cases when it comes to cancer. But we have to remember that just because someone has seen like a one-off case, that's anecdotal evidence. That doesn't qualify as empirical evidence. That's not the same thing as a clinical trial. And so these are the limitations of preclinical studies. What's interesting is that there is actually one clinical study out there that has been conducted in humans. And that clinical study looked at humans that have a brain tumor called glioblastoma. And what they did was they divided the patients into two groups. Both groups received chemotherapy, but one group, in addition to the chemotherapy, actually received CBD and THC. And they tracked their progress over the course of a year. And what they found was that at the end of the year, the group that received the chemo and the CBD and THC actually had a higher survival rate than the group that did not. So I think the numbers were something like 83% survival for the group that received the chemo plus the CBD and THC versus the group that just received the chemo and a placebo, which was somewhere about 53%. So that's the one clinical trial that has been done out there, and it was done in humans. Now, what's interesting about cancer is that it is such a complex disease that you may have success in one situation, but cancer is not the same across the board. As I mentioned, that was a form of brain cancer, but when you have other types of cancers, they may actually react completely differently. And so that's what's so complicated about cancer. And that's why there's so many different protocols when it comes to cancer. For example, You can have, skin cancer, which is treated completely differently from cancer that exists in the colon or other body parts. So this is an area of research that I'm extremely interested in because there are preclinical studies that show benefits and evidence. There is anecdotal feedback from clinicians that have seen some pretty remarkable things, but we do need more formal clinical trials to be able to back up some of these findings. And it is going to be something that is going to be fairly complicated because, as I mentioned, maybe something is beneficial for a certain type of skin cancer, but then not beneficial at all for a different type of skin cancer. So that's I did want to talk about that because I know a lot of people have heard a lot of different things about cannabis and cancer, and so I wanted to be able to provide some evidence from a medical and scientific viewpoint. So what are some of the clinical studies out there that have been conducted? This is really interesting because for a long time, people have seen benefits of cannabis for certain conditions, but because of legal constraints, a lot of universities were not able to conduct these clinical studies. Now, fortunately, we have seen legislative progress over the years, and so we have seen more and more universities start to conduct clinical studies, and they have released some of these findings that have been very interesting. So one of the first ones that were released when it came to CBD in dogs was a study conducted by Cornell University. And what they did was they looked at the use of CBD in dogs that have arthritis. And this was a randomized, double-blind, placebo-controlled crossover study. So it was a good, strong setup. And what they found was that the dogs that received CBD actually had decreased pain, as assessed by both veterinarians and owners. And the owners saw that the dogs were more mobile and more active. Now, Baylor's College of Medicine followed up with a similar study a couple of years later. And what they did was they looked again at CBD and dogs that have arthritis. This was a randomized placebo-controlled study. And again, what they saw was that the dogs that received CBD had decreased pain and increased mobility. This one was a study that was done by Colorado State University. And again, they looked at CBD and dogs that have arthritis. And what they found was that 30 out of 32 of the dogs showed decreased pain. Now, this study was done a little bit differently. There was no placebo control group. But what they did find that was interesting was that the effective range for the dogs in the study to be able to show decreased pain varied quite a bit. So some dogs showed decreased pain with as low a dose as 0.5 milligrams per kilogram, and then other dogs needed to go all the way up to 4 milligrams per kilogram to show decreased pain. So this study was interesting because they showed quite a difference in terms of the effective range of the CBD to actually demonstrate decreased pain. So you can see from 0.5 to 4, that's an 8-fold difference. And there are what's called pharmacokinetic studies that look at the way that individuals metabolize and process cannabinoids like CBD. And what's interesting is that those studies do show that individuals process and metabolize CBD differently. So, for example, in one dog, you may have CBD last a lot longer in their system than another dog that metabolizes it very quickly. So going back to the endocannabinoid system, what's remarkable about this is that there are individual differences in the endocannabinoid system. One of the most remarkable things that have been seen is that humans that have been studied have been shown to have what's called cannabinoid receptor polymorphism. That's basically a fancier way of saying that the shape of their cannabinoids receptors are a little bit different. So, for example, your cannabinoid receptors, CB1 or CB2, may be shaped a little bit differently from mine. What's important about this is that the research thus far has shown that differences in the way that humans' CB2 receptors are shaped are potentially linked to conditions like rheumatoid arthritis. And then conditions like ADD or ADHD and PTSD are shown to be linked to changes in the way that the CB1 receptor is shaped. And so this is really interesting because the research has been done in humans looking at this. And so my goal is to be able to take a look at this in animals as well, because I think it's likely that if we're seeing these changes in the way that the CB1 and CB2 receptors are shaped in humans, is that we'll probably see these changes in animals as well. And understanding these differences in the cannabinoid receptors can potentially impact the way that certain diseases are treated. A term called endocannabinoid tone is also very interesting because what this references is the body's the normal amounts of endocannabinoid that a body produces. And so there is a term called clinical endocannabinoid deficiency. This was a term coined by a famous doctor and researcher, Ethan Rousseau, who is very well known in research circles in regards to cannabis and the endocannabinoid system. And what he saw was that there are patients that have fibromyalgia, migraines, and IBS or irritable bowel syndrome. And when these patients are treated with cannabinoids, their symptoms improve. And so his thinking is that there could be patients who their body does not produce enough endocannabinoids naturally. And so by supplementing with phytocannabinoids, their conditions may improve. I think that this is very interesting because when we look at other things like, say, testosterone, for example, we know that as men age, as men get older, their testosterone levels tend to go down. And so it stands to reason that there is a good possibility that certain conditions, whether it's a disease state or maybe something having to do with age, can alter our body's ability to produce certain endocannabinoids like anandamide and 2-AG. And the altered production of these endocannabinoids could result in changes to our health or contribute to certain disease states. Now, there's also the possibility that the enzymes that make or break down endocannabinoids or even move them around the body could have different shapes, or they could be altered and have what's called polymorphism. There's a really interesting case of a woman in the UK who has decreased pain sensation and who doesn't really feel fear or anxiety. And what was found was that she has a polymorphism in one of her enzymes that naturally breaks down the endocannabinoid anandamide. And so the thinking is that because her enzyme doesn't break down the endocannabinoid like normal people does, is that perhaps she has high circulating amounts of these endocannabinoids that contribute to decreased fear, anxiety, and pain. So this is something that's very interesting because this is not something that has a lot of research out there, but you can see that this has the potential to impact the way that we understand diseases and potentially the way that we treat certain disease processes. Okay, so as I mentioned before, metabolism of CBD can vary amongst individuals. So, not only can we have differences in the endocannabinoid system, but the way that cannabinoids like CBD are metabolized can also be different too. So pharmacokinetic studies that have been done in both dogs and cats show that there is high variability among individuals, meaning that you could have, 2 dogs or 2 cats And when you give them a cannabinoid like CBD, their bodies may metabolize it completely differently. And so this just goes to show you that it's not a one-size-fits-all situation, is that every individual is created differently. And so we do need to be able to look at it from an individual perspective. So this is a picture that I always like to show people, especially medical professionals, because what it illustrates is that we are at the tip of a very large iceberg, one that we don't know how big it is. We just know that it's very big, and we just know that we're at the tip of that iceberg. And so the better that we're able to understand the endocannabinoid system, the better that we'll be able to understand and treat diseases. I hope through this brief presentation, this brief overview of the endocannabinoid system, you'll begin to understand just how important this system is, and in fact, just how little we know about it. And my goal is that for this piques your interest, and that you'll also talk about it to your physician, to your doctor, to your veterinarian, to your nurses, and I hope it piques their interest as well, because this is an important system that is not isolated. This is something that is deeply intertwined with all other physiological body systems. What we have seen is that the endocannabinoid system has influence and interacts with other body systems like the digestive tract, like the skin, like the endocrine system, like the nervous system, and the circulatory system as well. So it is something that is deeply rooted within our body systems and animals' body systems, and it does have a role in health and disease. The more we understand about it, and the more that we learn about it, the better we'll be able to understand and treat these diseases as well. So I do want to mention California Assembly Bill 1885. This is a bill that is going through the California legislative bodies this year, and it is a bill authored by Assembly Member Ash Kalra. This bill is something that will be the first of its kind in the world. And what this will do is it will allow for California veterinarians to recommend cannabis. There was a previous bill that we worked on that actually allows for California veterinarians to discuss cannabis, but it didn't allow for veterinarians to recommend cannabis. And so I'm sure, as many of you have experienced, when you try to talk to your veterinarian about cannabis and its potential therapeutic uses, they may be a little bit shy or a little bit hesitant to discuss that with you. But this bill will actually allow California veterinarians to recommend cannabis products for specific conditions for your pets. Additionally, it will allow for licensed cannabis products to be labeled specifically for pets. Currently, this bill is going through the assembly side. It did pass through the Business and Professions Committee with unanimous bipartisan support. It is up for the Appropriations Committee in a couple of weeks. And if you want to support the bill, you can go to petcannabis.org. You can sign a letter of support, or if you want to, you can also donate to the cause. And then any questions, you can always reach out to us. We're happy to help out however we can, because we do want to be able to see veterinarians take part in this, and we do want to see them recommend cannabis products for the pets, because we know that a lot of veterinarians have seen the benefits of it, but they are a little bit hesitant, and this bill will change that for them. And it will set a precedent, because it will be the first of its kind in the world. So with that will wrap up the presentation. And I think Candace, questions.
Yeah, thank you so much. This was so informational. I loved hearing about the research studies that are ongoing, especially the ones that had already been done on pets. And I just love when you use that acronym all the time, and I use it as well, the PAINS, the PAINS. So that's a great tool for others that are trying to educate or even just explain like the basics of cannabis and what it works for. So love all the things that you taught us today. Thank you again. So I do have a couple questions. One question is there any animals that have like a super endocannabinoid system that they're actually looking at specifically because they want to learn from that and how it works?
Yeah, so what's remarkable about this is that we actually know very little about the endocannabinoid system across different species. the the different species that have been studied the most are dogs and cats,
Hmm.
but there's still remarkably small amounts of research that have been done there. We are actually working with a number of universities in Colombia to study the endocannabinoid system in different species. As I mentioned before, there is a zoo in Colombia that has been using cannabis for a hyena, an electric eel, and there are some other interesting species that they are going to be using cannabis for. But in terms of the differences in the endocannabinoid system, we do know that there are some differences. For example, we know that the cannabinoid receptors in different species are very similar, but they're not 100% the same. And you can tell because the way that the DNA sequencing of these cannabinoid receptors are slightly different. We do also know, for example, that dogs have a higher concentration of CB1 receptors in their cerebellum compared to a lot of other species. And so what this means is that they are more sensitive to cannabinoids that bind to CB1 receptors, like THC, for example. This is not to say that there's no therapeutic value for dogs and cannabinoids that bind to CB1 receptors. We just have to be a little bit more cognizant about that and how we utilize it.
Yeah, that. Thank you for answering that and tying in the fact about dogs, because I think in my experience, like seeing dogs that accidentally get a hold of cannabis, it seems like they react very strongly to it. And I had wondered myself too if dogs have like a heightened endocannabinoid system. So that's thank you for answering that question. Can you also talk a little bit maybe about the negative side effects? Someone's asking about the negative side effects of cannabis, like what they should watch for and monitor with pets.
Yeah, sure. So, first and foremost, if an animal ever gets into cannabis, especially human cannabis like edibles, the first thing would be to see your veterinarian, because there are oftentimes other components like chocolates, for example, that can be toxic to animals. Oftentimes, when animals get into too much THC, for example, we do see side effects from that. For example, for dogs, we often see them swaying from side to side, losing their balance. Sometimes they will have urinary incontinence, which means inability to hold their bladder, so they may urinate uncontrollably, excessive salivation or drooling, or sometimes even vomiting. So there are a number of different signs that are out there that are characteristic of animals that got into too much THC. But the number one thing to do is in those situations is to see your veterinarian.
Thank you. Yeah, and I know that's something that a lot of pet parents worry about, and that we've heard some horror stories. So thanks for that advice. Somebody's asking about like catnip and how like cats just smell catnip and how it makes them really high. They're wondering if there's other animals and any other plants that are kind of similar to that, or like animals have that kind of reaction where they just have to smell a certain plant and they can get a reaction.
That's a good question. Yeah, and the way that catnip works on cats to do that is pretty unique and pretty interesting because it does happen through the smell receptors. As far as other plants that do that on other animals or other species, I'm not aware of any. It's not to say that they don't exist. It's just to say that I'm not aware of any.
Yeah, we get a lot of really good questions here. Like I'm like, I have never really thought about that before, but I mean that's the whole process of science. People ask new questions and you have theories and you test them, and that's where we're all going with this with cannabis and the wonderful research that you're part of across the whole world. Working in other countries as well. So this other question is like more general and not necessarily specifically about pets, but just what are your thoughts about the use of cannabinoids to help with like areas of dopamine that may be for partial cause for like restless leg syndrome. Um, so like I guess using cannabinoids to balance out lack of dopamine and conditions that are tied to that. What are
Well,
your thoughts?
I think it is interesting because the um, cannabinoid receptors in the brain are actually the most numerous G protein coupled receptors. So there are a lot of cannabinoid receptors in the brain. The full extent of and the impact of what those cannabinoid receptors do, we still don't know. So could they be used for certain neurological conditions or neurodegenerative conditions? That is an active area of research. So there are a lot of researchers that are looking into the use of cannabinoids for neurodegenerative diseases like Alzheimer's, like Parkinson's. So it's entirely possible. We do know, for example, that CBD tends to bind to a serotonin receptor called the 5-HT1A receptor. And it is thought that because it binds to that receptor, that's one of the reasons why it has anti-anxiety effects. So it is an active area of research. I do suspect that the more we learn about the endocannabinoid system and its role in neurological processes, that the more we'll see specific therapeutics that are targeted towards the nervous system.
Great answer to that question. Thank you so much. Last question. Somebody is saying that they have heard that the University of Kansas is doing studies on actually feeding hemp biomass to cattle, and that they found that those cows that are eating the hemp have like a tendency to kind of like rest more, to have like lower stress hormone levels in their blood. Have you heard of that research at all yet?
I haven't done that specific study. I do know that there are some folks that are very interested in that because there are a number of uses for hemp biomass, not just extracting the oil for cannabinoids or terpenes, but there are a number of groups that are interested in utilizing the biomass because we do know that the plant itself is edible. So, we as humans can eat the hemp plant. Certainly a lot of us eat hemp seeds or utilize hemp seed oil. And there is the potential to use it in livestock. I think the question that the regulatory authorities have is whether or not any of those cannabinoids are going to be ingested by the livestock and potentially passed on in their food products.
That'd be a funny one day if we had like a label on certain milk products. It's like, this cattle fed with hemp and how that might be like a selling point down the road. Very interesting. Well, thank you so much for giving your time, for putting together this wonderful presentation, for answering all of our questions. I am so appreciative of the work that you do, like educating people and also fighting for the rights of other veterinarians and pet parents. I'm so thankful to you. Thank you so much, Doctor.
Thanks for having me. I really appreciate it.
Yeah. So I want to thank your whole team as well. All of the girls and guys on your team are great and they helped make this possible as well. So shout out to like Zoe and Carmen and all those guys for helping make this possible. So to the audience, thank you for spending this time with us. I hope that we were able to share some information that will help you become better informed cannabis consumers and that the information that we've shared will help you find relief. Until the next time, stay well, stay healthy, and we'll see you again for another episode of the Pharmacy Cannabis Lecture Series. Thank you, everybody.